Hello and welcome to episode 30 of the LiveFitNow Podcast. Thank you so much for joining me today. I cannot wait for you to hear today's conversation. Today's guest is a GP based in Oxfordshire, and today we cover many things from the NHS, winter health, flu jab, whether we should take antibiotics, mental health, relationships with our GPs, and so much more. I cannot wait for you to listen to this conversation. Not only is she a GP, she also appears on BBC Breakfast and BBC Oxfordshire and is a wealth of knowledge, and is clearly very passionate and a great communicator when it comes to general practitioners. So without further ado, here is the conversation. I would actually love to start. Could you just give a little bit of a summary of where you are in your career, how you got here, and why you chose to do this as a job?
Sure. So, well, interesting. When I was at school, I thought for many years that I wanted to be a vet, and I did loads of work experience in vets and farms and that kind of thing. And then something just dawned on me at some point. I think that actually, though I like animals, that is not really my passion. And actually, what I was way more suited to was being with people. And so I studied medicine, and then after I qualified, graduated in Edinburgh and worked as a junior doctor for a couple of years. And at that point then felt that I wanted to do surgery. And my now husband and I went to Australia for a couple of years, and we worked in a big trauma centre in Melbourne, and then I worked in a cancer hospital for a year, which I absolutely loved, the Peter MacCallum Cancer Centre in Melbourne, and gained some amazing experience. And I became really interested in breast surgery and also did quite a lot of skin cancer work. And then we came back to the UK and got married and carried on. So my husband decided he wanted to be an anaesthetist, so he was training in that, and I was doing my surgical training. But after a couple of years, I kind of realised that things were really not the same in surgery in the UK as Australia. And what I really wanted was kind of my own, I wanted the ability to kind of really mould how I wanted to do things and the service that I wanted to offer. And also, to be perfectly honest, getting a little bit older, had a bit of a reality check, being married to an anaesthetist, we would sometimes go, literally we'd be living in the same house and we could go for 7 to 10 days without setting eyes on each other if we were on kind of opposite shifts. So I decided to quit surgery and started training in general practice, which was actually a little bit of a gamble, but quite quickly I realized that it really was for me. And what I'd loved all along, which I hadn't really realized, was talking to people and actually forming relationships with people and getting to know them. And that's where I am. So I kind of trained in general practice in Oxford, at a fantastic city centre practice. And then a couple of years ago, I got a partnership in Didcot, and became a partner. So very busy kind of running the practice with my other partners and doing clinical work. And what's nice is I still have an interest in breast surgery. So I was working as a breast physician in Oxford until quite recently, and still have links with that. So that's really enjoyable. But also now my other interests are, so I'm one of the student teachers. So I'm the student supervisor for Oxford University for our practice, and I'm one of the tutors for the medical students, teach communication skills, which I love, and supervise some of our junior doctors as well. So there's lots of opportunities in general practice. I have quite a varied job, and at the moment that's what I'm managing to do, which I'm really enjoying.
That's fantastic. It's so brilliant that you've been able to incorporate and continue with the skills you've learned over the years as well. It must be really nice to be able to put them to good use. And I was interested when you said you changed kind of your course because Australia was different from here. What is the difference between their healthcare and ours?
So in Australia, they do have a national health service, but they also have, so depending on your salary, you have to pay towards it. Or you can opt out of the public sector and you can opt to have private healthcare insurance. So there is more private healthcare around, which actually takes the pressure off the public system. So it generally isn't under as much pressure as the UK. I would so one of the other big difference for us was that their training programs are shorter. So at the stage that we were at, so if we'd wanted to stay in Australia, you would do surgical training in 4 years, whereas in the UK, you're looking at a minimum of 8. And that's a few years after qualifying. So, you know, you're training for much longer before you can really choose the specific route and work in a specific job in the specific hospital that you want in the UK. So it's a really long commitment.
Yeah, you really have to be sure that's where you want to be.
Yeah.
So I can clearly tell that you enjoy communicating with people. And do you think that is one of the most fundamentally important skills that you need to have as a doctor?
Yeah, I love communication. I love the concept of communication. I love teaching it. And I think the reason is that I think I've been in so many situations over the years where people can take things badly, things can go wrong. But actually, if you spend the time to really understand what that person is thinking and explain things to them in a way that they understand, and they understand that you understand them, it generally can get much better outcomes. People have more faith in you, people trust you. And actually, if people trust you, they're much more likely to follow your advice and take the treatment you're suggesting. If you don't have that trust with your patients, your outcomes are not going to be good. In the last surgical job that I did, I used to have a funny setup with one of my seniors. He used to say that I was the one that was good at doing all the talking and he would do the operating. So he'd often kind of tell a patient, right, you need this operation and now I'm going to leave you with Rachel and she will explain it to you because she's better than me. And it is funny, you know, we all have strengths and weaknesses. But I think particularly in general practice that being a good communicator it really helps do the best for your patients.
Yeah, because it really works both ways, doesn't it? I think there are perhaps some people of the general public that feel like they can't fully share with their doctors. So if you can build that rapport and that relationship and, as you say, explain things in a way that anyone can understand, it starts to build that trust.
Definitely. And I think also the benefit of general practice, which is lovely, is that you get to know people over a period of time. So, you know, some of my patients, I kind of, when I'm explaining to students, it's so different to, you know, seeing somebody that you've never met before in A&E to somebody coming in who I've known for years, and you literally pick up where you left off last time. And it's a continuing relationship and it's continuing forming trust. So it may be that people don't tell you something significant about their past or what they think for quite a while. And then actually when they've built a relationship and they trust you and they see how you deal with things, they will actually start to confide more. And for some people, that's really important.
Yeah, it's a massive trust relationship, isn't it? And are there any ways that we can all take better care of our health because you've seen common issues coming through your door? Are there things that stick out like a sore thumb that you're like, if you could address these issues, you'll probably see less people?
I think in some ways we are incredibly lucky in this country that we have the NHS, and I think there are very few people around now that remember a time before the NHS. So in some ways we take healthcare for granted, and you know, we've had huge steps forward with healthcare over the last kind of century. And I think as a result of that, one of the downsides is that people maybe always look to healthcare and treatments to sort their problems. And so I think a great example is something like type 2 diabetes. I feel really strongly that, you know, people who get diagnosed with type 2 diabetes, that, you know, a large number of these people actually can make a huge difference to their outcome by changing their diet, their exercise, addressing any weight issues. and it can really, you really see a difference in these people who can completely turn it around and reverse the disease process. That's not always possible, but even for people that can't completely reverse it, you see the people who really change their lifestyle, and impacts on the number of medications that they need and the side effects of the diabetes and the long-term consequences, compared to people who don't necessarily really change things and end up poorly controlled on multiple drugs. And I do feel really strongly that having the education and the know-how and the ability to try and improve your lifestyle is just crucial.
And do you find that it's a bigger percentage of people that want to make those changes, or is it pretty split as to some people that just want to be fixed?
Difficult. I mean, I think what we have to, for example, talking about the diabetes, I don't want to underplay the fact that it is incredibly difficult, to address diet and weight loss and exercise, and especially if you have other factors. So, people will fairly frequently say to me, well, I can't exercise because I've got knee problems, and that kind of thing. And sometimes you can get into a little bit of a vicious cycle. I'm not sure what proportion it would be, to be honest, but I think there are definitely, variations in people's approach to self-help.
Yeah, it's an interesting one. And would you say there are top 3 things that people come and see you for?
So at the moment, and we're talking kind of post-COVID, I would say that we are seeing a lot of people with troubled with mental health issues. That's always been a very common theme in general practice, but at the moment, I would say that our numbers have dramatically increased. Now, the other top 3, I should know what the top 3 presentations are to general practice, but so things like dermatology problems, skin problems, ENT, ear, nose and throat, they're very common. So generally managing chronic disease forms a large part of our job. So things like asthma, diabetes, COPD, heart disease, high blood pressure, managing that kind of thing forms a decent chunk. And then, of course, you have kind of infectious diseases, childhood illnesses. We see a lot of that. Musculoskeletal issues, see lots of that. But pretty varied, but we do see some common themes.
And do you think there are any things that, if we could change deep in our society, that we would see less of? Do you think there are common problems that we've got that perhaps, if we could wave the magic wand and address them, that you think would make that shifting difference?
Well, I think overall, in our generation, so we are generally living a more sedentary lifestyle. So obesity is a huge issue in our population, and linked to that obviously links in with diabetes, heart disease, risk of cancer. And if we think along the lines of unhealthy lifestyle, then it just has a knock-on effect with so many things, with cardiovascular illness, but also inactivity, which leads to musculoskeletal problems and actually leads to mental health problems. So I think the overall switch that we have moved in this century to kind of having very manual jobs to having much more sedentary lifestyle, and a lot of disease has kind of adapted and is related to our lifestyles in that way.
So it's really trying to change our lives, that those things that have been taken away, that have been done by different things, creating new ways to move our bodies and experience the world without having to wash our clothes and do all those sorts of.
Yeah, absolutely right. And I think also we look at the foods that we eat and the alcohol intake that we have, compare that to kind of our great grandparents' generation. It is very, very different, with processed food, fast food, sugar content, alcohol intake. It is dramatically changed. Of course, there were problems in diets at that stage. There was far more malnutrition and the opposite end of the spectrum, which thankfully we don't see as much now. But no, our kind of ways of doing things definitely have inherent health risks with them.
Yeah, of course. And I kind of want to tie these two things together because I think there's probably some overlap, but feel free to separate them if you'd prefer. But I think this year more than ever, obviously it's unprecedented. We've never lived through anything like this before. Are there things that we can do not only to keep ourselves as fit and healthy as we can from COVID, but also coming into the winter and the cold and flu season and all those, that next round of challenges that actually we face every year? Are there things that we can do to best prepare ourselves?
I think one of the most important things that we can do coming into this winter is actually to mentally prepare ourselves. I think we have come through a really tough, well, where are we? We're kind of at 7 months now, aren't we? That we have not been able to do what we want to do. People have had financial worries, people have had job worries, people can't spend time with their families, they worry about their families, people may have been significantly ill with COVID, and many people have obviously lost loved ones with COVID. So on the back of a very difficult 7 months, we are now potentially facing a really tough winter. And if we have further lockdown, if more jobs are lost, if more people are unwell, if we have more restrictions, I think it's got the potential to really hit us hard mentally. The way that I am seeing it and the way that I am preparing myself is that I am trying to every day focus on what I can do. Now, I'm obviously very lucky that I have a secure job, and that obviously has a huge impact if you have money or job worries. So I'm not belittling that. But from a kind of lockdown and social perspective, what I trying to do is really focus on what I can do and make adaptations to carry on doing the important things. So, for example, rather than thinking, so we're a family of 4, and we would obviously previously see other families who are friends with their children. We obviously can't do that now because of the rule of 6, but rather than thinking, oh, we're not going to see them indefinitely, trying to adapt and do things like meet in small groups. So for example, I'm seeing one of my good friends with my goddaughter and my daughter, so 4 of us will meet as opposed to 9 of us meeting, which obviously sticks to the rules. And yes, it's different, and it's frustrating that you can't just meet how you want to do, but just trying to think of things you can do. I think also, again, trying to look at how you can keep active, get outside, do lots of things. I'm making a real point of trying to do as much outdoor activity as possible, whilst that's not limited, and whilst we can do things, getting into those habits for the winter, because I think if we're in the habit of doing things, it makes it a little bit more sustainable, continue over winter. And yeah, just not kind of thinking too far ahead and worrying about what's not going to be possible. I'm trying to not even think about Christmas, for example, just taking 1 week at a time, what we can do now, how things are looking, and trying to stick to the positive thoughts rather than focusing on the negatives. So that sounds like a very simplistic view of things, but I really think people need to try and bring their mindset into a positive spin for this winter.
Yeah, as you say, the simple things are the things right in front of them, things we can change and have control over. And I think actually people have felt so out of control for so much of this year. It's so much easier, I think, to manage our thoughts and our feelings if we do just shrink it right back down to, as you say, the days and week ahead, rather than thinking months ahead, because so much can change also. So much that almost don't worry until you reach it, because you can deal with it in an immediate moment rather than that long-term momentum. And are there any things that we can add to our diet? Are there any supplements you recommend? Should we get the flu jab if we're able to get hold of it? Like, what do you recommend when it comes to those sorts of things?
So with regards diet, I think we always best approach to things is generally to have a healthy, balanced diet. If you have things that you miss out of your diet, for example, if you're vegetarian or vegan, you need to really make sure that you are supplementing your diet with the things that you're missing. It's really important. With regards other supplements, so there's been a lot of talk about vitamin D recently. So we produce vitamin D by sunlight hitting our skin. In the UK, because obviously we don't get huge amounts of sunlight, or especially about half of the year, we do realise that we see quite a lot of people with vitamin D deficiency, and actually there is some feeling that vitamin D is involved in our immune system and in fighting infection. Now, those current guidelines, the criteria of who should take vitamin D is a really good page on the NHS website, worth having a look. But if you do feel that you're somebody who's not getting much sun exposure throughout the year, taking a vitamin D supplement would be recommended. And actually, in certain parts of the UK, it's recommended for everybody. Otherwise, just general, straightforward approaches to healthy living. So not smoking, and getting help with that. If you think that it's something you want to do, get some help and try and quit. Minimizing your alcohol, drinking kind of moderate amounts of alcohol as per the national limits that are recommended, and also getting outside and getting regular exercise. I can't stress that enough. And I think some people are a bit intimidated by that when we say get out and get exercise. It doesn't have to be going and doing a 10-mile run. Going for a 20-minute dog walk is actually great. And I say this a lot when I go for a slow run and I'm trying to make myself feel good. It's better than sitting on the sofa. Getting out there and getting your blood pumping, and actually just getting some fresh air and a bit of headspace is so good for you. The flu jab you mentioned, yes, the flu jab is highly recommended. It's recommended every year because we know that in this country about 10,000 people die from flu each year. But this year we're really pushing it, because what we don't, it is kind of twofold. We don't want people to become unwell from flu and then get COVID and get even more unwell. But we also need to think about the provision of the NHS. And if we have a bad year with the flu and we've got many people in hospital with it, that's going to really affect our ability to manage other things and to manage people with COVID. Now, anybody over the age of 2 can get a flu immunisation. It may be that you do not qualify for a free NHS one. There's lots of different criteria. So children up to year 7 at school will be getting them at school this year. But actually, if you don't meet the criteria to get an NHS flu jab, you can get them from a pharmacy. Now, I know at the moment there's problems with availability, and that's really frustrating for people. But what I would say is just keep checking, hoping there's going to be more availability as the winter progresses. We're being told that there's going to be more vaccine made available. Just keep an eye on it, and if you can get one, it's really worth doing.
Great. Thank you for sharing that. And actually, I was thinking as you were explaining that, I wonder, have you noticed a rise in people coming to you for general issues again? I assume that sort of when the initial lockdown happened, people really didn't want to bother you with anything other than something they would consider super serious. Are people now coming back for more generalized issues, or do you still think people are potentially avoiding it? And do you have any advice to people that might be worried about something?
Yeah, so I would say kind of it was actually quite a short period for us that we felt that people were staying away. We had the busiest summer we have ever had in our practice. We were seeing, so summer is normally a little bit of a quieter period, but it was incredibly busy. And I think that was a combination of things, really. It was people not being abroad over summer, so being in the UK, people having a bit more of a focus on their health, because there's so much talk about health and, people generally wanting to take care of themselves. And there was obviously a bit of a backlog of things that people had felt they didn't want to come to the GP about in lockdown. I feel now that we have kind of caught up. I feel that we're back to normal a little bit. We are consulting, a very normal number of people for this time of year. Now, you still occasionally hear somebody say, "Oh, I haven't wanted to call you," but that's few and far between, really. The majority of people, I feel, are consulting their GP. However, there is always that funny situation that we don't really know the people that aren't contacting us because they're not getting in touch. So, there is still a concern nationally that some people are not coming forward with concerning symptoms. And like NHS and like all GPs are promoting at the moment, it is really important, if you have any health concerns, to consult your GP. I think some people have been put off by the fact that we're doing things quite differently. And what I would say is we still need to talk to everybody before seeing them. Seeing people is no longer a straightforward process. So we have to ensure they don't have COVID symptoms. If they do have COVID symptoms, we can still see them, but we need to do it in a very different way, in a different part of the practice. We cannot have people with potential COVID mixing with our vulnerable patients in other parts of the practice. We're staggering our appointments much more. We're just doing things in a very different way that takes much more planning. So we really need to speak to people before they come in. And I think some people are often a little bit put out by that. They feel like we're refusing to see them. We're not. We're absolutely not. We're seeing many, many people every day, but we have to do it in a really cautious, calculated way.
Yeah, I mean, in some ways, is it allowing you to speak to more people, because you can have potentially a phone call with some people? They don't even need to come into the practice necessarily. So I guess it allows you to potentially speak to more people within a day.
Yeah, absolutely. I mean, there are so many conditions that actually you don't need to see someone face to face, or we're using video consult, of course, but we don't need somebody there in front of us for many, many conditions. I would say something like mental health problem is a great example of that, especially if you know somebody already. Having a phone conversation, touching base, seeing how their mood is, that kind of thing. You don't need to physically examine them, and a lot of this can be done over the phone. And actually most people really like that, because they're carrying on with their day. They're not having to take time off work to go and sit in a waiting room when I'm potentially running late and it takes them loads of time. It slots into their day better, and people generally like the phone consulting.
Great. Do you think it will continue going forward, even as we at some point move out of COVID?
I think we will probably always do more phone consulting than we previously did. But I do think it's incredibly important that we still have the option for people to come in. And there will always be things that need face-to-face consultation and examination. But for some people, they really struggle on the phone. It's not for them. And I think having the option of coming in is really important to always be there.
Yeah, absolutely. It's a great option. And so if anyone has any sort of symptoms that they're just not 100% sure about, you recommend just giving their GP a call, or perhaps going on the NHS website? I mean, is that the sort of first two port of calls?
So the NHS website is a really good tool. It's very reliable. And I think people often look online for things, but maybe people don't have the experience to spot what's good, reliable information and what's not. And actually that can sometimes be really scary, because you see things which are just not accurate. But the NHS website is a great tool. There is so much information on there. And also you can use the NHS app where you can query your symptoms and get advice. So yes, if you are wondering what to do, have a look at that, or just get in touch with your GP. And now there's generally multiple ways of getting in touch with your GP, whether that's through a kind of email consult, submitting a query, or a phone call initially, potentially with being seen.
Yeah, we certainly live in a wonderful time of technology in that sense, so much connection. And I'd just love to come back to the fact that you brought up mental health as being one of the biggest issues that have come up this year, and obviously actually year on year has been a growing problem. And how do you think, on one hand the NHS, on the second, as a community, as a society, can we address these issues? Because I could be wrong, but it sounds like this is going to be a massive, and perhaps is already a massive, burden on the NHS, and it's a very difficult amount of people to actually be able to give the time to and manage. So are there ways you think that we can create support networks, or there may be particular ideas that you have in mind that we can all help each other, because this is clearly a growing issue that's not going anywhere.
Yeah, I mean, I think mental illness, mental health is a huge problem that we face. And I think it's an incredibly complex issue which has many underlying features, underlying causes, kind of societal problems, economical problems. I think there's so many factors which contribute to what we're seeing. In a positive way, I think we're also seeing more because I think people have more awareness and there's less stigma. So that's a positive thing that we're seeing more, and people are coming forward with it. With regards to resources, I think there's a general feeling that it is a very under-resourced service in the NHS, and at times people can wait a long time to have support and the input that they need. I would like to think that that would be addressed, that services would be better funded and have more availability, especially in young people and children, which is where we often see the really long delays and waits. What we have seen coming into certainly where I work and across the country, because there is so many issues, you see these wonderful organisations coming up, and charitable organisations which form to address a lot of these problems. So we work with several organisations in our area, several charitable organisations that offer amazing community support, mental health support, lots of different programmes. And I can see that those kind of organisations are going to become even more crucial. And it's only really over the last couple of years that we have formed kind of official partnerships as a general practice with these organisations. I think it's been a huge step forward. And I think that interface between healthcare and kind of community services and community charities is going to be more important as we go forward, really.
Yeah, and if people are having any challenges and troubling thoughts, but perhaps are a little bit apprehensive to come and speak to their GP, and I think people are probably held back for multiple reasons, some because they want medication, some because they don't want medication. I'm guessing it's very much an individualized thing, and just because you walk through those doors, it doesn't mean you're going to be forced down any particular path. You're just opening that door to start the conversation and help them in the way that they need to be helped.
Absolutely. So it would never be considered good practice to really kind of force one treatment. So, you know, there is lots of evidence to show that different approaches work in equal success in mental health. So, you know, whether we're talking drug treatments, talking therapies, we know that they all have their place, but actually it's different for different people, and some people just cannot face the idea of medication, whereas some people really struggle with the idea of talking therapy. So it's really important that when people come to see us, we really look at them as a whole, their situation, their job, their family, what's really troubling them, and think about the best approach. And we will advise, but of course always support their decision. What I would say is, if you are somebody that really thinks about this and just doesn't want to see their GP, there is a whole host of really amazing online resources that you could look at, and just get a general feel for things and see whether that's the kind of thing you're interested in engaging with. So for example, charities like Mind have amazing online resources, and you can sign up to online courses. That's worth considering. But if you really get to a really low point, and even if you've not been to your GP for years and you're thinking, I don't know this person, I'm not really keen, but if you're really struggling, if you're having really dark thoughts, then please do come and see us, do contact us, because we are here to help, and we do see these things all the time. There is nothing to feel awkward or embarrassed about. You will never be judged, and we would really encourage you to get in touch.
Yeah, sometimes the people you need to talk to are those out of your circle. I hope will feel touched by that. And there's a question I love to ask people, and I hope there's not too many, because I can imagine you could be here all evening. Are there any common myths linked to your field that you would like to debunk?
Oh, that's a really good question. let me think. Okay, I am going to go for one which we're about to see lots as we come into winter, and that is about antibiotic prescribing for people who have things like sore throats and colds. Now, a lot of time we see people who have a viral illness, and they think that we're being really mean because we're not giving them antibiotics and think we're trying to be awkward, and actually what they really need is some antibiotics. So just to kind of explain how it works, it's not just a gut instinct when somebody comes that we make a decision. We may be doing kind of in our head, but when we see somebody and we're assessing somebody, we are using evidence-based methods of calculating the risk that somebody has a bacterial infection or a viral infection. So classic one is a sore throat. We look at several different factors and we work out the likelihood that this is bacterial. And there's really strict protocols that we follow for this. Now, if somebody has a viral infection, antibiotics will do nothing. They will give you potential side effects, but more importantly, they may give you long-term problems if you start to develop bacteria which have resistance to multiple drugs, and you don't want to find yourself in that situation if you become unwell in the future. So please don't think that, you know, if you come to GP thinking you really need antibiotics, we're not being awkward. We're making a thorough assessment and calculating what the risk is and what's best for you and in the long term.
Interestingly, on the flip side, antibiotics are such an interesting one, because I think people are either very much pro them and want to have them as often as possible if they feel ill, or on the other side, scared that if they do have them, they're going to have issues further down the line. And is that a valid worry? Is there anything we can do to counterbalance it? And do you recommend any sort of probiotic once you have been on antibiotics, just to try and help rebuild the gut health and the gut bacteria?
Yes, that's a really good point, because I guess I get a skewed view, really, because I'm generally seeing the people who would like treatment, whereas the people that really don't are maybe staying at home and not wanting to see us. So it's a really good point. So the main thing to follow is that, of course, if you have an infection that needs treatment, it's important that we treat them, but it's about making a decision and not treating things inappropriately that we know antibiotics don't change the outcome. So things like sinusitis, quite an unpleasant scenario, quite an unpleasant feeling, painful, but there's very few indications for actually treating that with antibiotics, because we know the outcome isn't changed by antibiotics. But when you're feeling really unwell and you just want something to fix it, don't you? So I would say really important to just not have unnecessary treatment, so following the advice of somebody. Probiotics is an interesting one. Some people do consider that. I think if you've had really strong broad spectrum antibiotics, some people find a benefit. I don't know the hard evidence of it. It's not something that we prescribe alongside antibiotics, but some people do choose to try it.
Yeah, that's great. It came up before when I was speaking to an optometrist, and she's a doctor, and she said sometimes people will come to her when they have eye problems, and obviously there are also pharmacists and there are different experts that may be able to help with problems that you've got, and they may potentially be a better port of call, because obviously the NHS is stretched. That is still an issue, even forgetting this year for now. And do you think there are any common things you see that in reality you're probably not the best people to come to? There are other options that will probably be quicker for them to get an answer, and they're more specialists in the thing that they have an issue with.
Yeah, I think we see that quite a bit, actually. And I would say a really common example with that would be a lot of musculoskeletal problems. So often we will see people, and what we'll be doing is basically making sure that there is nothing really serious underlying that needs further attention, and addressing things like pain relief. But then actually what people often need is to see a decent physio and to do some good exercises and get some good support and advice from that. I'd say that's a really common scenario. Now, sadly, of course, not everyone can afford to go and see a physio privately, and often, again, with many things, there'll be a waiting list to see an NHS physio. But we do have things these days like online videos for people to watch and different exercise programs for people to follow. So I'd say that's the most common scenario where I'd think that they're better off with somebody else's advice.
Yeah, sometimes there are specialists out there that are perfect for your problem. And what do you think the biggest issue or challenge that the NHS is facing in the future?
I think there's several really, but I think what we're struggling with as a society is that we, as we make medical advances, I think our expectation of healthcare continues to increase. And that's very reasonable. If there are new treatments out there, why shouldn't you want them? Of course, we all want them. But I don't think the expectations of what we want from our healthcare match what we actually pay for as a society. And, I'm not an economist, and, whether it's an issue with taxes or what proportion is put into the NHS or how it's spent, I don't know. But I think our expectations of what we want from healthcare doesn't match what it can safely and realistically offer at the moment. So I think there needs to be a shift change at some point as to whether we decide that we want to invest more in our NHS, or whether we want to, as individuals, accept that there are limitations with what the NHS can offer us and prioritise what those things are that we want. But it can't offer everything that people want at the moment on the current budget.
And I think, it's really important to realise we can be so much more empowered than we allow ourselves to be, because I feel like the NHS, because it is so overwhelmed, is so often on the back foot that it's trying to, it's rather than preventing, it's reacting. And perhaps almost if we were to step back, where some budget needs to go in, is trying to show people that actually you can not get sick in the first place. You don't necessarily need to have, just because we have this wonderful medical care doesn't mean we need to use it necessarily. And if we make particular choices as a society and as individuals, we can end up needing it less, but having it there at a much better level, because it has the time to really invest in those people that are in desperate need.
Yeah, no, I think we have made huge inroads with this kind of thing. If we think about things like campaigns of quit smoking, that's had a huge impact. If we look at things now that we have like weight loss support and weight loss programs, we have pre-diabetes education programs where if people are approaching the level of diabetes, they can go on courses to learn about lifestyle and diet, and all of those kind of things you wouldn't have seen 20 years ago. Of course, we've always had in the UK, we've had a long time, we've had a very good immunisation programme, which is obviously all about keeping us well. And we also have things like NHS health checks when you reach the age of 40, looking for things like high blood pressure and high cholesterol. And we have really good cancer screening programmes. So though, I think we've made huge advances in our public health and our disease prevention, I think we still have a way to go. You're absolutely right. But I think we recognise the importance of it, and we're on the right track, but there's still more work to do.
Yeah, you can feel the change within your career.
Yeah, absolutely, and I think we are in. I think our generation of doctors want to empower people and want to promote them looking after themselves as well.
Yeah, everyone can get so much more from it that way, can't they? What is your vision for the future? Because you are all obviously a very good communicator, and that is a big part of your life. Do you have any goals in the future so that you can get to and help more people?
Over the last kind of year, I've become involved with in our area something called social prescribing. So that is really, a lot of the stuff that we've been talking about, really, but kind of putting a label on it, where we're kind of encouraging things in people's lives that will make them well, but not medicines. So whether that is kind of looking at health, kind of fitness, weight loss, whether it's looking at social isolation or mental illness, that's an area that I'm really interested in, and working with some amazing organisations in my area. And I can see that that's something that I will pursue more as I go forward. I've been really lucky over the last year or so as well to get much more involved in the medical student teaching at the University of Oxford, and I'm doing more of that, and I absolutely love it. I love talking to the students. I love their enthusiasm, and I'm becoming old. I love telling them stories about what I've done and giving them tips. I really enjoy that, and I would like to see myself doing more teaching as we go forward. But the lovely thing about medicine is there's always new opportunities around the corner. Who knows what there will be and what we will be facing in 5 years. So there may be something that I haven't even considered that will end up being a big part of my career, which is really exciting.
Yeah, it does sound exciting. And again, because you're coming from a different perspective from myself, as you say, we've all got our skewed vision of the world because we see a lot of the same stuff. Do you think the public as a whole understand how to make their lifestyle better? They may not be able to do it, but do you think they know what it is? Do you think that there's a general consensus of, we need to hydrate well, we need to eat well, we need to move our bodies, however that may be, get out in nature, we need to speak with one another, we need to prioritize sleep, like all these different pieces of the puzzle? Do you think that knowledge is there yet, or do you still think we've got quite a long way to go?
I think it's a mixed bag, really. I think we see some people who have very, very good knowledge about healthy living and looking after themselves. But I think equally we have large numbers of people who sadly haven't necessarily had healthy upbringings or had access to healthy food or understood the importance of exercise. And they've never had that in their life. And it's very difficult for these people to suddenly adopt these different ways of life and different ways of doing things differently. I think we're making progress, and I think health education in this country is very good, and it's really now we recognise the importance of starting it really early in schools and before schools even. And I think we're making progress, but I think in some populations we have a huge way to go.
Yeah, it's a long-term journey and quest for sure. And this is a question I like to ask everybody, and it can be on a personal or professional level, but what inspires you?
This is going to sound really cheesy. I'm inspired by actually adding something to society. I know it can be small things, but if I was doing something where I didn't think I was adding anything back or leaving a mark on anything, I would feel disappointed. And I still aim to make way more of a mark and achieve more things, but that's what inspires me, that I can make a difference to people, or make a difference to systems or to healthcare in an area, or just to the way something is done, just making a difference.
I love that. Not cheesy at all. It's such powerful thoughts. And I would like to start drawing to a close and give you the floor to share one thing that you think everybody would benefit from knowing.
Ooh.
That always silences everyone for a few seconds.
Okay. I think sometimes you can go through ups and downs in life, and you can sometimes try and do what everybody wants you to do, and you may get lots of different advice. But sometimes what you actually need to do is think about yourself. And somebody once gave me some advice, which was to be kind to yourself. And sometimes what you need to do is kind of pause, think about what you need, not what everyone else needs you to do, and think about how you can achieve that going forward. And whether that's, a health problem, how you are going to get the time in your life to deal with it, whether it's a mental health problem where you're going to get the mental space to do it. I think sometimes people need the permission to actually look at themselves rather than, looking at everything around them. But that's a good thing to do, and you shouldn't feel guilty of doing that. It's really important to think about yourself sometimes and how you can heal yourself and move forward.
Yeah, I love that. We are surrounded by distraction and are constantly busy with something. And actually just taking a moment is in some ways one of the simplest things to do, but probably one of the last things that most people do. So I love that. It's such a simple thing. Be kind to ourselves. And this is how I indeed found you. Where, if my listeners would like to find you, can they find you on the internet?
So I am on Facebook and Twitter and Instagram at Dr. Rachel Ward GP. As we were discussing earlier, Vicki, my pages are fairly new, but getting more information on there all the time. And also you may spot me on various TV programs. I'm on BBC Breakfast most weeks, currently mainly commenting about COVID and current health issues, but popping up in various places and on some BBC radio shows as well. And I'm hoping myself to start doing some interesting interviews. So maybe I'll be getting you to repay the favour by interviewing you next time, which would be lovely.
Yeah, no, it's so wonderful, and again, it's that strand of communicating with people, because the more people you talk to, it could be that one little nugget of information that makes such a big difference. And the more you can get your voice out there, you can connect with people in so many different ways. I will pop those links into the show notes so people can click directly through and give you a follow.
Thank you.
Thank you so much for your time today. It has been wonderful.
Oh, thank you. I really enjoyed it.
Thank you for listening to episode 30 of the LiveFitNow podcast. I hope you enjoyed that conversation with Dr. Rachel Ward as much as I did having it. I think there were so many useful pieces of information and things that I'm sure we have all learnt. So once again, I appreciate your time. I would love if you could rate and review the podcast, share with your family and friends. And if you have any questions from this episode or any of the previous episodes, feel free to click through on the show notes to get in touch, or email me directly, hello@livefitnow.co.uk. I hope you all have a wonderful week. Until next Thursday.